Hey guys, so we're here today in Central Park, and our next topic is a very well-known topic again, and it's going to be that on alopecia. So alopecia is a very big topic. I can never even really explain every single thing about it, but we're actually going to be discussing 4 major types over the next coming weeks. So again, our topic for the next few weeks is going to be that on alopecia. So alopecia is actually an umbrella term. So there are actually 2 major categories of alopecia. So first we have the scarring kind, and then we also have the non-scarring kind. So with the scarring kind, it pretty much means that the hair follicles have been replaced with scar tissue and the hair loss is pretty much now permanent. Now with the non-scarring kind, that pretty much means that there's no scar tissue there and the hair is more likely to regrow. So our first type of alopecia that we're going to be discussing is that of alopecia areata. So as said before, alopecia areata is actually a non-scarring form of alopecia. It is actually thought of as an autoimmune condition. So what happens is our white blood cells actually go in and attack the hair follicles when they're not supposed to, and then those hairs actually either slow down its progression of growth or it completely stops and falls out immediately. So with this form of hair loss, what it looks like, it actually looks like a round or coin-shaped form of hair loss where the spots are patchy and then there are actually no hairs there. So I'm going to actually insert a picture right here so you can get an idea of what it looks like.
So here we have a patient with alopecia areata. I'm actually standing in the back after I've done one of his treatments. You can see after about 5 months he's getting a pretty good result. He's not yet finished, but pretty good so far.
So with alopecia areata, there are really no major symptoms other than actually hair loss. So by that I mean there's no itching, there's no pain, there's no scale usually. It literally just looks like a patch of hair that has fallen out. However, with this condition, it not only happens on the scalp, but it can actually happen in any hair-bearing area. For example, for men, sometimes it can happen in the beard area. It can also happen in the brows. Alopecia areata does not discriminate, so it doesn't matter how old you are. You can be very young or even very old. You can be of any ethnicity, and it still can happen to you. So there are many treatments for this condition, so definitely go see your clinician. But even if you decide not to go see anyone, this condition actually can resolve by itself within a few months to a few years. So when you go into your doctor's office or your clinician's office, they may actually decide to do a few different kinds of tests. So they may decide to do some blood tests to make sure that it's not, again, associated with any other autoimmune kinds of diseases, such as thyroid disease. They may even decide to do a biopsy. Most times, in my opinion, since this condition is very clinical, meaning that you can actually diagnose it on exam, there's really no need to do any other kinds of tests. If it's one tip that I'd like to give if you have this condition or if you know any else with this condition, is control your stress. So stress is actually one of the known triggers for this condition. So you can be given the best treatments in the world, but if your stress is not under control, then this condition is more likely to happen again and again and again. So from our day-to-day activities, if it's that job that you need to take a vacation from, if it's that relationship that you need to reevaluate, do whatever it is that is necessary in order for your stress to be controlled, because literally stress can cause your hair to fall out. So if you don't want that to be you, definitely take a break or even talk to someone about the stress that you're having in your life. So again, thank you for joining me at Kendra J. Derm PA. I hope you learned something new. I hope you took away something from this talk about alopecia areata. Stay tuned for our next talk on the next form of alopecia.